Competency 1. Demonstrate ethical and professional behaviors. The practice behaviors include making ethical decisions by applying the standards of the NASW Code of Ethics, relevant laws and regulations, models for ethical decision making, ethical conduct of research, and additional codes of ethics as appropriate to context. Using reflection and self-regulation to manage personal values and maintain professionalism in practice situations. Demonstrate professional demeanor and behavior, appearance, and oral, written, and electronic communications, using technology ethically and appropriately to facilitate practice outcomes, and use supervision and consultation to guide professional judgment and behavior. Presented by Lacey, Taylor, and BethAnne.
My first piece of evidence that I selected is a group meeting that I was able to lead at my practicum site. And what we did in this group meeting was, as a committee, we gathered together to develop a plan or a path towards our goals and dreams. And through this, I was able to guide our committee and really use ethical and professional values that I've learned in the social work program to ensure that I wasn't pressing my own ethics onto other individuals, and really it helped me to be able to take a step back and focus on the needs and values of other individuals that were in the group. My second piece of evidence is a course that I took while I was in the MSW program to get my certificate to become a qualified developmental disabilities professional. In this course, I had to learn a lot of different ethical and professional strategies. One of them included ethical and appropriate use of technology. In this, we talked about HIPAA and had to learn about all the different compliances that we had to follow so that we could appropriately communicate in regards to clients and individuals that we were working with. We had to learn that you have to communicate over a secure network, otherwise you can't email detailed information about a client. To meet the HIPAA regulation, you have to have everything under 3 layers of lock, so regular email doesn't necessarily always comply with that. We also learned how to demonstrate ethical and professional reasoning when working with clients of many different ethnicities, races, and religion. And it also helped me learn to identify that sometimes clients have different code of ethics than I have, and how to combine those together and ethically work with a client and make sure that you're honoring their own personal code of ethics. My third piece of evidence is my presentation from Dr. Wesley's practicum class. And in this presentation, I learned many different ways to utilize the people around me to use supervision and consultation when faced with an ethical dilemma. I was able to utilize my classmates, and I was able to utilize my practicum supervisor when I was concerned about an ethical choice that had to be made. And that really helped me understand that sometimes it's best just to take a step back and utilize the resources around you when you're trying to make an ethical choice. At my practicum at Southern Illinois Community Support Services, I work with SILA programs, which are community integrated living arrangements. And currently in the SILA program throughout the country, there are quite a few policy and waiver changes that are really going to affect how we are able to implement services for the individuals that we serve. One of the big pushes that is going to be in effect is integrating CQL's 21 outcome measures. And in their book, they talk about the different outcome measures to figure out what is each person's individual code of ethics. And I've had to do a lot of research with this and present it to the individuals who are on the committee to help make the changes in the organization. Through these committee meetings, I've had to learn how to ethically and professionally establish relationships with all the different individuals on the committee and make sure that I am understanding each individual's own professional and ethical reasons and needs.
I chose to use my certificate of completion from going to the Managing Anxiety and Depression with Adolescents Who Are Self-Harming and Struggling with Suicidal Ideations. It was a seminar that helped us understand how to communicate better with adolescents who are going through their own struggles and who are self-harming and having thoughts of suicide. So this met the competency because it helped me to demonstrate professional demeanor and behavior in oral communications so that I was able to communicate with the adolescents in a professional and ethical way while helping them deal with all the struggles that they are going. My second piece of evidence is a bariatric evaluation. We complete the bariatric evaluation at my practicum in order to assess if a client is in the right mental state to have the bariatric surgery. So we complete the evaluation and ask all the questions that we feel are necessary to determine that, and then we put together the document that in order to collaborate with the other doctors, telling them what our thoughts are and if we think that they are eligible for this surgery or not. So in order to complete this, I have to use the competency of just demonstrating professional demeanor in written and electronic communications. So whenever I write these reports, I have to make sure that I am presenting myself in a professional and ethical way because I am collaborating with the other doctors. So I also meet the competency by using supervision and consultation. So I meet with my supervisor in order to talk about the evaluation and then put the report together. So she kind of coaches me on making sure that I am using professional and ethical communications when I'm writing the reports, as well as making sure that I'm being ethical whenever I'm sending reports via fax or email or things like that. For my third piece of evidence, I am using the motivational interviewing training that I attended during the MSW program. This training really helped us to develop our skills in order to work with clients in a professional and ethical way by the way that we communicate with them. It also taught us how to kind of put aside our values and focus on what's important to the clients. And so that directly relates to this competency by helping me demonstrate professional demeanor in oral communication, especially whenever I'm working with clients. It's important for me to stay professional, make sure that their values are what's important in the situation, and work off of that. I'm completing my practicum at Family Life Consultants, which is a private practice therapy office, and we do therapy with individuals, families, couples, and groups. I myself have a caseload of approximately 10 clients that I have been seeing on a weekly basis since the time that practicum started, and then I do evaluations such as the bariatric evaluations just as needed whenever those clients come in. So during my time at Family Life Consultants, I have learned a lot from Covey and his book, The 7 Habits of Highly Effective People. The 5th habit in his book is seek first to understand, and that has really helped guide some of my practice, which directly relates to this competency by making sure that I am first focusing on the client and their values and ethics and putting my feelings, my values, my ethics, things like that to the side, and making sure that I am focusing on the client and what's best for them, and making sure that I'm acting in a professional way with my values and my ethics.